So good afternoon and good evening if you are joining from Brazil. I hope all of you are safe and in good health, and I'm very happy that we are resuming our activities as part of the programming for the Center for Brazilian Studies at UCLA. So on behalf of Cindy Fan, UCLA Vice Provost for International Studies and Global Engagement, Chris Erickson, Associate Vice Provost and Director of the International Institute, and Kevin Terraciano, Director of the Latin American Institute, I would like to welcome you to Brazil, Bolsonaro, and COVID-19, a conversation. This is the first public event sponsored by the UCLA Center for Brazilian Studies following the COVID-19 crisis that resulted in our campus modified schedule of events and classes. So for the center, this conversation will serve as an opportunity for us to share experiences, discuss the current crisis, and test new ways of connecting people and delivering socially responsible content and new research focusing on Brazil. This is also an important moment for us with the Latin American Institute, because I'm very happy to announce to the followers of our activities that this event was conceived and executed by our new colleague, Brian Pitts, who was hired a few weeks ago and brings new energy to the Institute. So Brian Pitts is Assistant Director of the Latin American Institute. He earned his PhD in Latin American history from Duke University and has published extensively on historical and contemporary Brazilian politics in both academic journals and media. By the way, this event would not have been possible without the tech support from Alex, Oliver, and our dear Kaya from the Information Systems and Technology Office at the International Institute. So maybe, Brian, you could say maybe a few words about the event and the structure or the format that we'll be following, and then I can introduce some of our panelists and speakers.
Sure. Welcome, everyone. Sejam bem-vindos, todo mundo. This is actually going to be the inaugural, the first in a series of events that's going to be put on by UCLA's International Institute about the global response to the COVID-19 pandemic. We focused on Brazil today specifically because, Zay and I care a lot about Brazil. It's where we study, but also because Brazil's approach to the pandemic has paralleled in so many ways that of the United States. Some of the same controversies that have surrounded President Trump and some Republican governors have also surrounded Bolsonaro as he advocates a quicker return to normality and a quicker ending of social distancing. There's been a lot of debate about that in Brazil and internationally, so I thought Brazil would be a great place to start for those of us in the United States, because there are so many parallels to our own situation, but also important differences. For our format today, we're going to have each of our three panelists give introductory comments in 5 to 10 minutes or so about their own areas of expertise, which we will tell you as we introduce them. After that, the three of us who have organized the event will be asking some questions, some targeted questions at them to encourage some sort of discussion among them. And of course, you can submit questions as a viewer through the Q&A feature on Zoom. And the panelists will be able to see that as well. So without further ado, Zay, would you like to introduce our first panelist?
Sure, my pleasure. I will be also helping or redirecting your questions. We will be collecting questions from the Q&A and from the Facebook Live comments. And you can ask your questions in English, Portuguese, or Spanish. I'll do my best to redirect the question or translate if needed. So our first panelist is Maria Amelia Veras. She is Professor of Epidemiology at the Collective Health Department of Santa Casa Medical School in Sao Paulo, Brazil, where she coordinates the graduate programs in public health. She has over 25 years of experience in conducting epidemiological studies related to HIV/AIDS in Brazil, especially focused on the LGBT community. She is the leader of the research group Nudes, Health, Sexuality, and Human Rights of LGBT+ community. She's currently the site PI in Sao Paulo, Brazil, for 2 large NIH grants. Her research interests include stigma and its role in health inequalities affecting the LGBT population in Brazil. During the COVID-19 pandemic, she is part of the technical advisory group in epidemiology and mathematical modeling of the Sao Paulo City Health Department. So welcome, Maria Amelia Veras. Thank you so much for agreeing to participate in this event.
Thank you so much, Zé Luis, for the invitation, and thank you for Center for Brazilian Studies in Latin American Institute of UCLA. I remember I was there in an event about HIV/AIDS many years ago, and since then I haven't been in LA or in touch with many of the colleagues here. So it's a great pleasure for all these reasons. Well, as José Luis introduced me, my field of expertise and research is really HIV/AIDS. But in COVID, we were all here trying to help to understand and to guide what could be the response to this epidemic. I am particularly working with the municipality of São Paulo, where I live. Before COVID-19, we were already experiencing in Brazil a series of political, I would say, interventions that could have, or now we are observing the consequences over the response of the country to the pandemic. So we've been cutting budget from the healthcare system, from science and technology, from education, from the universities. So we are, in a certain way, under the current government, dismantling the system that could be put together at this moment, and are doing this in spite of all the cuts. To give a strong response to this emergence, this big public health emergency in the country. So we live in a situation very tense because there is a battle, a constant battle between public health officials, public health servants, researchers, universities and research institutes in the country in one side, trying to put together information and to produce evidence that about what is going on in the country, and give some advice for the authorities to give response. And in the other side, our president, with a very, I would say, responsible and irrational position regarding not only the COVID itself, COVID-19 and all its consequences, but also in not understanding the need in this moment to unify resources and fight against a very important, I would say, problem, to fight and to defeat a problem. I don't like that much the war metaphor, but it has been used a lot in this moment. So I will start here with this introduction. Thank you again for inviting me, and I hope we can discuss a little bit about what's going on here.
Thank you, Amelia. It's good seeing you after so many years. Let me see. We have our next presenter from Brazil. It's Brian Meir, who is a co-editor of Brazil Wire, Brazil correspondent for the Telesur English news program from the South. He's also international relations coordinator of the Brazilian news channel Brazil 247, and editor of the book Year of Lead, Washington, Wall Street, and the New Imperialism in Brazil, published last year. He has MA degrees in human geography and sociology and has been living in Brazil for 25 years. Welcome, Brian.
Thanks a lot, José Luis. That was a very thorough introduction. I didn't know you'd go all the way to mention my degrees and all that stuff. I appreciate it. Well, I know I only have a few minutes here, so I'm going to try to be brief. If I am going on a little bit too far, someone just tell me when, you know, if I have like 30 seconds left, and I'll just wrap it up, because it's a big subject, you know. Basically, I was in a seminar with John Ross last week about the Chinese response to the coronavirus crisis, and he talked about how really there's three approaches that are going on around the world right now. There's the kind of Chinese approach, which is prioritizing human life above all other aspects of it. You know, there's the herd immunity approach, which was initially suggested by Boris Johnson and kind of abandoned when Lancet came out with its study telling exactly how many deaths that would result in. But what we have mostly is this kind of like half and half approach, in which there's some efforts made at lockdowns and quarantine and things like that, but it doesn't take the full prioritization of human life above all other elements of it, as you have like in China and some other countries in Asia, like Vietnam maybe. And in Brazil, basically, that's what we have right now. We have this kind of half and half. And it's very much like the United States. It's not being propelled by the president or the federal government. The initiatives that are rolled out to protect Brazilian citizens against infection and things like that are mainly being done at the state and the municipal levels, with very wide differences from state to state and even from city to city in some places. And so I think, as Brian mentioned earlier, it's like it's really interesting to compare against the United States. Basically, just to be very brief here, we had a parliamentary coup in 2016 in which President Dilma Rousseff was removed from office for a budgetary infraction that legally was not considered an impeachable offense. It involved no personal enrichment of funds or no embezzlement of funds. And it was legalized one day after she left office by the Senate, and she was later exonerated from it. She hadn't even done it. Before she was thrown out of office, she issued a decree dedicating a large percentage of Petrobras, National Petroleum Company's profits, to the national public health system. That was immediately undone. Further cuts were made to public health. They passed a constitutional amendment under Michel Temer, freezing public health spending for 20 years, despite the fact that Brazil has a growing population. And then when Bolsonaro took office, he undid a program that Dilma Rousseff had created to address historic problems in the Brazilian public health system, which was that the position of doctor is something that carries a lot of prestige with it in Brazil. It's normally something that's taken up by people from the upper middle class, and normally they want to live in big and important cities. And so there was this huge gap of doctors in country areas and in poor areas. And so she brought in 11,000 Cuban doctors to work in these areas. One of the first things Jair Bolsonaro did after he took office was he expelled the Cuban doctors from the country. At this time, there were about 8,000 of them. After they were kicked out, very few people took the job positions that they left vacant. So right now we have a situation in which 33 million people across Brazil do not have doctors in their local public health clinics. This is mainly in rural areas. You know, they might have an ambulance to take them to another town or county or something if they get sick, but there's actually no doctors in those areas. And so what we have right now is that we have a president in power who's essentially a puppet of US interests. And we see this carried out in the way he's responded to the coronavirus crisis very clearly. Even though he's been signaled out in the international media recently as this kind of pariah, this kind of like world's worst example of the response to the coronavirus crisis, basically all he's doing is copying Donald Trump, who happens to be his personal idol. So when Trump says coronavirus is nothing to worry about, it's just like the flu, Bolsonaro says the same thing. When Trump says we have to finish quarantine by Easter, Bolsonaro says the same thing. Trump starts arguing with the governors and giving favoritism to one governor over another for political reasons. Bolsonaro does the same thing. So I wrote an article recently for FAIR about this, in that he's kind of being signaled out in the media right now so that people can feel good and say, oh, look how bad it is over there, you know, to take away attention from what's going on in the United States and the UK right now. But luckily, okay, and another quick thing I'd like to point out related to this is that Pepe Escobar has written repeatedly about this. Brazil seems to be a kind of battleground in this new hybrid or full spectrum war between the United States and China, geopolitically speaking. And so we have a situation in which even before the American media started saying that, giving lip service to this right-wing conspiracy theory that coronavirus was started in a laboratory in China and is being spread maybe to destroy capitalism in the West and things like that, we saw Jair Bolsonaro, one of his sons, tweeting it out, and we've seen 2 ministers in his cabinet tweeting it out like 1 week before CNN started reporting on it, before the State Department started announcing that they believe this to be the case. And this infuriated China, unlike, I don't know exactly the situation in the United States, but, one of the key errors that Bolsonaro is making in this case is just that China is the single most important trade partner with Brazil right now. So when his son did this, it infuriated the Ruralista lobbying group, which is the agribusiness lobby, the most powerful political lobby in Brazil for the last several hundred years. And the many factions of the right have started splitting with Bolsonaro over this. However, as he comes on TV and calls for the end of quarantine on a daily basis now, in a similar way that Trump's holding his press conference in the US, some people in the business community are supporting him, including the president of Banco do Brasil, which is the largest bank in Latin America, and other prominent businessmen are saying people should go back to work. Of course, they're talking about poor people who have to go back to work. They're probably going to stay in their quarantines. So finally, just to end this very quick introduction, I'd just like to say there's some things about what the governors are doing that give me hope living down here. And when the US government sent me a letter saying I should return to the United States because of the coronavirus crisis, I chose to stay here because even though the public health system has been cut, they've made cuts to it recently, we still have a functioning public health system with universal access. People are not going to refuse to go to the doctors because they're afraid of going into bankruptcy here. And some individual state governors are doing a really good job. And I'd like to highlight Maranhão Governor Flávio Dino, who just smuggled 107 ventilators into the country from China through Ethiopia so that he could bypass both the US government, which is stealing ventilators from any country in Latin America can find right now, and Bolsonaro, who's been blocking shipments of ventilators up to the state. And today he won a Supreme Court victory in which the Supreme Court ordered that a ventilator company in Santa Catarina immediately, within the next 48 hours, send 67 more ventilators up there. The shipment had been blocked specifically by Bolsonaro, right? I could go on and on about what different state governors are doing, but I will end it at this, and just with a final word, that it seems like the curve has been flattening a little bit because of some of these quarantine orders and lockdown orders being made by the different state governors.
Thank you, Brian. Very thoughtful contribution. We'll have a chance just to remind those who have been following and to let you know, those who have joined later, we're going around. Our panelists will have are having a chance to say 5 to 10 minutes to a few words in 5 or 10 minutes. And the idea is to channel in to the panel your questions. Please feel free to ask questions using Facebook Live or the Q&A function in Zoom. The panelists will also ask questions amongst themselves or to each other. And our next presenter is a dear friend, good colleague of mine, Dr. Karin Nielsen, a professor of pediatrics. She's specialized in infectious diseases at UCLA. She's originally from Brazil and has a long-established collaboration with many Brazilian institutions across the country in the fields of HIV, Zika virus, and other epidemic infections. She is working on a COVID study in pregnant women with COVID in the United States and Brazil, and also in other vulnerable populations. Dr. Karin Nielsen is a former director of the Center for Brazilian Studies at UCLA. Welcome, Karin.
Hi, good afternoon, boa tarde to everyone. It's nice to see my good friends. Maria Amelia, how are you? Miss seeing you. And Bonnie and Jose Luis, thanks for inviting me. I took on the task of going over a bit the biology of coronaviruses, given what I do here, and I'd like to share some slides just sort of to illustrate the main points and give sort of a retrospective of where we are and and talk about Brazil. So I think if I can just share my screen. Would that be, am I able to share my screen here? I guess so.
I think you are.
Okay.
It's working.
It's working. Okay. So sorry about this. This is just very, very brief. I just wanted to talk a little bit about what is coronavirus and how did it get to Brazil and what has happened since it got to Brazil. And I'll do this in less than 10 minutes because I talk really fast. But for just in the sake of interest, coronavirus is really called the coronavirus because it looks like the sun corona when you have an eclipse. So when it was first seen actually by a lady, laboratory technician in Canada who was originally from England and saw this
Karin,
on electron.
We cannot see your slide. Can you check if it's enabled? We cannot see the screen sharing.
Okay, resume.
Can you cancel the screen share and try again?
No, I said resume share. So let's see if that works. Does it work?
Not yet.
Yeah, all we're seeing is a black screen that says that Karin Nielsen has started screen sharing.
Yeah, let's see it again. Share screen. And let's go here. Share. Okay, can you see it?
Yes, yeah.
Okay.
Thank you so much.
Sure, and if I go like this, I wanted to put it, can you still see it? Yep, okay. So anyway, coronaviruses is a class of viruses that are known as RNA viruses. They have an envelope, and this is important because when we use soap or alcohol, that destroys the envelope of the virus and kills the virus. And it's one of the largest RNA viruses that we know of. It's big when compared to other viruses, and it is a virus that causes diseases not only in humans, but also many other mammals and also in birds. And there are many coronaviruses. This is not the first virus to be described. It was actually first identified in children, and there are other coronaviruses, these human coronaviruses of the alpha group. They can infect people of all ages, and they can cause respiratory illnesses, which are fairly benign. It's one of the common cold viruses. Then we have these other coronaviruses, which are in the beta coronavirus group, of which SARS was the first one. We remember this epidemic in 2003 that originated in China and caused outbreaks in Canada. Very deadly virus, 20% mortality. And then we had the MERS virus in 2012, which caused an outbreak in the Middle East. The camels were actually intermediate hosts and helped spread. And now we have SARS coronavirus too. So everything we're applying to the biology of coronavirus comes from our prior experience with the other coronaviruses that are in nature. Coronaviruses, this is just the human coronavirus. There's hundreds of other coronaviruses that infect animals in nature. So we all know about the Wuhan outbreak and how it started and the market that was associated with it, the first cases and the response in China. And it is very interesting that the disease is called COVID. It's coronavirus disease, and the virus is SARS coronavirus too, and people use these names interchangeably. Now we know that even though you can have symptomatic disease with mild respiratory symptoms, a lot of people can have very, very mild symptoms or not have any symptoms at all. And it is thought that a lot of the people who have no symptoms also contribute to the transmission of the virus. When you are first sick and you have a runny nose or a cough, that's when you tend to be most infectious and you shed the virus, which is very important for transmission because people who don't know they're sick or very slightly sick, they're walking about and around and transmitting the virus. And of course, we had a tremendous spread because we're an interconnected world. And we noticed from the beginning, since the China outbreak, there was an age-dependent phenomenon in which older people were more susceptible to death or to severe events following infection. And why does the virus kill? The virus kills because, not necessarily because of the virus itself, but your immune response to it. It causes in some people this inflammatory response, which they call a cytokine release syndrome, in which you have release of all these proteins and antiviral substances, which actually infect your lung, cause damage to your lung, and cause the disease that we see with people, being short of breath and eventually requiring to be on ventilators if they progress. So the mortality of coronavirus has been very debated. When China first said the mortality was 1%, we had published a paper thinking that mortality was more around 5%. And this is data from today just to show that different countries have different mortality rates. And Brazil is, with the number of reported cases, it is at a 6.4% mortality rate. But these numbers are very variable because you need to test people to know how many people are sick and how many people will die. In Brazil, as many other countries, including the United States, has had tremendous trouble in testing large segments of the population because this is a simple math question. The more you test, you pick up asymptomatic people, you would reduce the mortality. If you only test the sickest of all people, you have a very high mortality rate. And that's what's been shown across the world. In the situation in Brazil, Brazil actually had a, compared to other countries, the first case was reported in the end of February, and we've seen an escalating number. As of today, there are nearly 46,000 confirmed cases in Brazil and about 3,000 deaths. But this is certainly underreported because in Brazil, you're only getting tested if you're sick and you're admitted to the hospital. There's not widespread testing of the population unless you are very affluent, you have connections to laboratories, and someone is willing to write a prescription for testing. Most people are not tested. So this is most likely underreporting. This is from last night. As we can see, São Paulo has the biggest burden of cases in Brazil, but there are many centers like São Paulo, Manaus, Fortaleza, and also Rio are the capitals that are most affected and are seeing the greatest number of cases. The virus transmits very well in very dense areas, very densely populated areas. And of course, these are all large cities within Brazil, but the virus can also go into rural areas. And we've seen this increased number of cases in Brazil, and the number of deaths is probably very underestimated as well, because these are just people who were tested and found to have coronavirus. As we've seen in other parts in the world, there's an excess number of deaths just in April for many other countries, as we can see here in these curves. And probably the way that Brazil should look into this to see how many deaths have happened due to coronavirus is not to look at the people who were tested and died, but as the excess number of deaths as compared to last year, for example. And we will see that this is probably a much bigger problem than is being reported. This is just to highlight what happened in Brazil historically. It was February 25th that the first case happened. And in early March, investigators from São Paulo reported that probably that first case was an individual who came from northern Italy based on sequencing of the virus. And I would refer people to this article in Lancet Infectious Diseases that was just recently published. It talks about COVID in Latin America. And it talks about the number of issues that are faced and as challenges. You know, one that we've already mentioned, that the president has repeatedly minimized the threat of the virus, as has happened in the US, and has undermined all the efforts to enforce social distancing, which is really what we all know flattens the curve. The problem is that Brazil has multiple epidemics. It's faced chikungunya, Zika, yellow fever, and dengue epidemics very recently. We were involved in a big Zika effort just a few years ago, and there's no vector control now because of social distancing. So we're going to see other epidemics escalate because other measures are not put in place. Of course, we have the issue of the communities, the favelas, as written in the article, where you have over 13 million Brazilians living, and it's not possible to practice social distancing in the setting. It's crowded, hand washing, it can be difficult, and this is a tremendous challenge. Brazil also has one of the largest prison systems in the world, where you have vulnerable people who can get coronavirus as well. So Bolsonaro has been failing with all the directives, as our colleagues have mentioned. In fact, his own committee, returning from a trip to the United States, several members of his group fell ill to coronavirus, and even so, they have minimized the threat and said that social distancing is not necessary. So this is something that will have to be dealt with. The other problem is the capacity in terms of testing and what Brazil would have to do to offer all these tests. Most of the tests are done by institutes and and public institutions that are involved in research, and they don't have the capacity to run all these tests. So you have to engage public labs and private labs in order to offer all the testing to the population that is needed. And just to finalize, as of tomorrow, if anyone leaves without a mask in Rio, they will be charged a fine of 140 reais. Also like to say that there are 8 field hospitals being built right now in Rio de Janeiro, which is my hometown. 2 of them are being built with private funds, which is a new thing I have not seen in Brazil happen in recent years. And the other six are an effort by the government of Rio to curtail the epidemic. These field hospitals should offer about 2,000 beds to people affected by COVID who need admission to the hospital. So I think this is about it. Of course, I haven't mentioned, and I think the panel will discuss the economic and social impact that COVID will bring to Brazil in terms of to the economy and to people who live on a daily wage and all the businesses that have to be closed so that social distancing can be maintained. But the repercussions to Brazil will be enormous. So I think that's about it. Sorry to give a sort of lecture, but I thought the slides would illustrate the phenomenon with dealing better than me.
Well, thank you so much, Karin. This was very thorough, very informative, very helpful. And just to remind people that you can submit questions using the Q&A function in Zoom or the comment function Facebook Live. Our next presenter, who will help us to transition into the Q&A session of this program, is Bonnie Tao, my good colleague and friend in the Latin American Institute and Latin American Studies MA program. Bonnie is a medical anthropologist, is associate director of the Latin American Institute, co-chair of the Latin American Studies MA program, and is also on the faculty at the Fielding School of Public Health at UCLA. She conducts research and teaches courses about community health, food and culture, immigration, shamanism, and Western medicine, and human rights among peoples in North America, Latin America, and Europe. She also collaborates with nonprofit organizations and leads educational and anthropological workshops for clinicians, educators, lawyers, and artists. Welcome, Bonnie, and thank you so much for participating in the panel today. You have to unmute yourself.
Let's see.
Okay, now I can hear you, yes.
Okay, I can't see anybody anymore. I'm not sure where everyone went, but I will proceed speaking. I'm not sure.
I can see you, and I think we are online. We are live,
okay,
and
okay,
and broadcasting. So don't worry.
Okay.
Yeah, we're here.
Okay, thank you. Hello, everyone, and thank you for joining us today. Thank you so much, Professor Jose Passos, for organizing this, along with Brian Pitts. We're so pleased that you had the idea for this wonderful program, and we're so pleased to have you now at the Latin American Institute. Thank you so much to all the panelists for participating. On behalf of myself and Director Kevin Terraciano, we're so delighted and pleased to launch this series of talks on COVID-19 in Latin America. I just wanted to say a particular thanks to all 3 of you for putting in perspective these very important contextual aspects, political, economic, public health, historical, as we proceed in talking about COVID-19 in Brazil. Brazil certainly is a place that people turn to in the region, and as so many have talked about, this is an unprecedented situation for public health systems worldwide, and certainly the case in Brazil. As you mentioned, Karin, that article in Lancet does a nice job of an overview, and I think it's critical to point out all the vulnerable groups that exist across the continent, from the poor to those in prison, to those living in squatter or favela settings, so many other people with comorbidities that you pointed out. So as we proceed now in our talk today, I was thinking about the fact that Brazil had the first cases, and then I know from the Pan American Health Organization's data and a little bit in Lancet that other countries, Ecuador, Peru, Chile, also have started to see a rise in cases and mortality. I was wondering if you, Karin, and Maria Amelia could please talk a little bit about what the situation is like on the ground for the healthcare workers, for the patients. You so nicely gave us some of the epidemiological information, and I think a lot of us would be very interested to know kind of a on the ground perspective of what it's like in terms of also PPE, you know, the equipment, the supplies, but also some of the psychological and emotional impact that this is taking on the health sector and on its personnel, as well as the larger society and population. So I think I'll stop there. Can you still hear me? Sorry, I can't see you. So, hello.
Hi, Bonnie. We can see you. So
okay. I'm not sure why I can't see you, but
Maria Amelia, do you want to respond? And I can add into, since you're in Brazil.
It's okay. Okay, Karin, I can start. Thank you for your question, Bonnie. And I think that the first thing to say is Brazil is it's huge and it's very heterogeneous in terms of how the situation is right now, and the level of infrastructure, response, health personnel, and the tensions really varies across the country. So what we know, I've been working with São Paulo data and São Paulo information, but what we know about is that especially a city like Manaus is in a very big tension and risk right now. It's the highest mortality and lack of infrastructure. We know that the healthcare system in Manaus that was already being, I would say, fragilized by several measures of some of the ones Brian commented before. Not only underfunded, but also transferred part of the administration of the public system to private organizations. And before COVID-19, there was a huge crisis in some of these organizations. So especially medical doctors quit their job, and Manaus, a city that had already lost more than 500 doctors because they were not being paid. So the COVID-19 relies, and the response relies in vast majority on the public health system. And the public health system, although fragilized, is doing the effort to reunite and to respond with all the resources available. So it varies a lot from city to city. The situation also in Fortaleza, which is a big city, has more than 3 million inhabitants, and the last week didn't have any ICU bed available anymore. They are building hospitals, campaign hospitals that call COVID hospitals. It has been an extension of beds, but we all know that's not easy and it's not very fast to build and to bring capacity for intensive care units, for instance. You need trained people that are not trained in 24 hours. So this is something that we need investment to middle and long term to get a good response. So it really varies this situation from place to place. I would say that the time that we've been doing the social isolation in various degrees in Brazil, it has been crucial in terms of mobilize these resources and build new beds and bring new people to the system and hire health professionals, train them, it's been really crucial. I don't know what would happen in Brazil right now if we didn't have adopted social isolation against some federal opposition in the president at this time. In São Paulo, so there is tension. The healthcare providers are tense. There is a fear in the population. There is fear from healthcare workers. Not all of them are well equipped with EPI, and this has been provided slowly, and it's increasing the number that have now. But at the beginning, we had very critical situation. I would say that São Paulo city is, we haven't seen the big crisis that we've seen in Manaus or in Fortaleza right now. Few hospitals had already fulfilled, all the beds are occupied with COVID, but we still didn't exhausted the capacity of intensive care unit beds or hospital beds for those who need in São Paulo. As the epidemic is evolving, the municipality of São Paulo is building, they built 2 big hospitals, 2,000 beds, and these 2 hospitals are not 100% occupied up to now. So it's very important that we keep the social isolation. And in the meanwhile, the healthcare system is trying to rebuild its capacity. A crucial thing that Karin already mentioned is diagnostic. So we haven't been able to test everybody or to test the suspects. Testing has been restricted to hospitalized cares with severe respiratory conditions, symptoms, and not with mild symptoms. And now we are trying to expand the testing for healthcare professionals to see if we have an idea what's going on with them. So to summarize and not make a very long answer, I would say that the situation is really a mosaic of different levels of tension and different levels of infrastructure and response.
Thank you, Maria Amelia. Oh, go ahead, Karin.
Oh no, I was just going to add that the epidemic across the world has taken a tremendous toll on healthcare workers, even in Brazil as well. They have been exposed to the virus. There's a large number of healthcare workers that have died from COVID. And when you have a lack of protective equipment, PPE, people are dying unnecessarily because of exposures that could be avoided. From my hometown of Rio, because we're talking almost on a daily basis and trying to establish a COVID study there, I know that even though, as Maria Amelia has said, the resources have not been exhausted, but surely the public hospitals, at least, it is thought that in the very near future, the ICU beds will be exhausted in Rio. And Rio has actually, the state of Rio has actually put together 8 field hospitals, what they call campaign hospitals. One of them will be in Rio Centro, which is a large hospital, and it is thought that at least 2,000 additional beds will be open to the public for people who need admission and need, ventilatory support. I have to say that ICU care is very complex, and you might see varying death rates depending on the quality of the ICU care you have available. I do infectious diseases. I'm in the hospital all the time, but if you put me to manage someone on a ventilator, I wouldn't know how to do it. I would have to relearn all of this, and these things change very quickly from year to year. So you need highly specialized personnel, doctors and nurses and respiratory therapists, and a lot of equipment, because when you intubate people, you aerosolize the virus. So it's not an easy task. So it's not just opening up beds in a stadium and saying, well, we have a hospital. This has to be managed very carefully with very good care and people who know what you're doing. You need expensive equipment. You're monitoring their oxygen levels in the blood. So there's a lot of laboratory support that is required for this. So you will see varying rates of deaths, maybe based on the ICU care people are receiving as well. So this is very important. In terms of the psychological burden, of course, healthcare workers are worried that they're going to get the disease. They're worried about infecting their families. And this is also in Brazil when things become so chaotic and you see people piling up, as is the case in northeastern Brazil and Fortaleza and Manaus, which have seen the crisis happening so close. It's a big problem. But Rio and Sao Paulo seem to be headed in the same direction if this virus continues to increase. And there's a lot of concern about what will happen when this disseminates in the impoverished communities for the reasons that we reviewed. And that stresses out everyone, especially the healthcare workers.
They're very good questions. And we have excellent questions coming in from the attendees and participants who are in Brazil and in different parts here in the US. I'm gonna let Brian pick a couple of questions and so that we can go around again, go back to the panelists, and then I'll pick myself another 2 questions for the next round. Brian.
So I would like to direct our first question to Brian Meir, although our other 2 panelists are welcome to give answers as well. I have a question from Rafael. Chief of Staff, the Planalto Palace Chief of Staff, General Braga Neto, just announced a major governmental plan to preemptively activate the economy in Brazil with over 70 major public works projects with 30 billion injected into the economy. So 2 questions about that. Does this mean the military is becoming more directly involved in running the government? And if so, would this perhaps provide a better and more rational take on the approach to the crisis in Brazil? And would this also mean a shift from the neoliberal course conducted by the current government so far?
Well, that's an interesting question that nobody has the answer to and everyone's arguing about right now in Brazil. Basically, excuse me, about 2 weeks ago, a renowned Argentinian journalist was on a talk show on Argentinian TV or radio, and he said that he had it on good authority that a high-ranking member of the Argentine government received a call from a high-ranking member of the Brazilian military telling them that they should just not listen to Bolsonaro anymore, that the operational side of the presidency was being coordinated by a task force led by General Braga Neto, who's Bolsonaro's chief of staff. Excuse me. Since then, though, and that had repercussions in the Brazilian media, the international media. Even Tariq Ali tweeted out that there had been a kind of secret coup inside of Brazil and the military was not running things. But since then, like, Bolsonaro has struck back. What they said at that time was that Bolsonaro's health minister, who was arguing with Bolsonaro every day, Luis Mandetta, was Bolsonaro would be unable to fire him because the military had stepped in and blocked this from happening because they were worried about keeping quarantine up, and they were worried about Bolsonaro's response to coronavirus and that he was isolated. But then Bolsonaro fired Mandetta. Bolsonaro went out to a public protest in favor of shutting down the Supreme Court and Congress and gave a speech there last Sunday. And so it looks like there's an attempt, and then to make things even more confusing, right? General Vilas Boas, who is another very powerful general inside of the Bolsonaro administration, said that he favors ending quarantine last week. So my impression of this all is that the military itself is kind of split on this issue. I had not heard this new announcement from Braga Neto. It sounds like it could be good news, but it's important to remember that the Supreme Court has issued an order preventing the presidency from ending quarantine orders at the state level anywhere. So right now, the federal government doesn't, in legal terms anyway, depending on how much rule of law is left in Brazil, doesn't have the power to end these quarantines and get people back to work. João Doria in Sao Paulo has announced that they're going to start rolling back gradually the isolation order May 11th. But if the hospital system maxes out by then, right now, currently the public hospital system ICU wards are at about 80% capacity, but they're up from like 70% a little over a week ago. If the public hospital system collapses by May 11th, I doubt seriously that Doria is gonna continue with the side of rolling back quarantine. So it's hard to summarize. It's hard to really answer that question. It seems like a positive sign that Bolsonaro is being isolated, but a negative sign that the military's at risk of taking things back over again.
Thank you, Brian. Any other thoughts? We have other interesting questions coming in. I can pick another one. Anybody else from the panel? So, two questions from Joseph Marcus about international cooperation. Is Brazil doing anything regarding assistance to its neighbors, especially Venezuela? Do you have any information about that? For Karin and Maria Amelia in particular, are Brazilian health agencies cooperating actively, as far as you know, with specialized global health agencies, NIH, CDC, France, Switzerland, UK, China, etc.? Do you have information about that at the federal level and or the state level?
I do not have information about the level of collaboration between the federal agencies and the international agencies. What we know is we keep cooperating at the level of universities and research institutes. So there is a huge collaboration being established between several universities in Europe and the United States and universities in Brazil, not only to study COVID, but in clinical trials and modeling responses and all these things related to the response. But officially, I don't know. I don't have this information.
I would add that there are a lot of requests for proposals that have come out of the NIH, the US NIH, which we are, as Maria Amelia said, applying to in collaboration with colleagues in Brazil. So there is a certain level of collaboration to that effect. Also, state agencies like FAPESP, FAPERG have issued RFAs, that this would be funded by the local governments to support COVID research. We've actually applied for a number of those as well. So we're certainly getting support. And I know that many European countries have offered support in that sense as well through their government research agencies. But at the government level, exactly, I'm not sure. I'm sure that the CDC is working with Brazil, as the CDC works with everyone, and is monitoring this. But at what level Brazil is supporting or helping Venezuela, I have no idea, to tell you the truth. I would suspect there's not much aid going in right now, but that's my impression.
Could I say something here really quick?
Just okay.
Go ahead. You want to go first?
No, I would just comment that on the news, what I read is that they intensify barriers at the border of Brazil and Venezuela to avoid migration flow. This is what the last news that I read on newspapers. So I suspect that it's not helping, and by the opposite, is taking measures to block the flow of migrants from Venezuela.
Brian?
Okay, I'd just like to jump in really quick. First of all, Brazil is siding with Trump in the hybrid war against Venezuela right now. They actually just shut down the Venezuelan embassy, or they shut down the Brazilian embassy in Venezuela. They're not doing any cooperation with Venezuela. Regarding international cooperation with Brazilian governmental or government-funded institutions on coronavirus, it's important to mention that Brazil has one of the best tropical disease research and public health institutes in the world, which is Fiocruz. Okay, Fiocruz is like a network of research and public health institutions that have offices in something like 16 Brazilian states. They have a budget of nearly $1 billion in 2019, despite the budget cuts. They have capacity to produce their own vaccines and medications, which they do. And they've recently been designated by the WHO as a reference institution in the world fight against the coronavirus pandemic. The only other reference institution in the Americas is the CDC. So not even Canada has one. And I think it's important to cite that because a lot of people in the North have this idea that maybe because of all of the problems with Bolsonaro and the coup and everything, that Brazil might be some kind of like failed state with dysfunctional institutions. And Brazil actually has a long and rich scientific history of fighting pandemics. It did better in the response to the HIV/AIDS crisis than the United States did, significantly, you know? And so I'm not saying that this means everything's wonderful in Brazil, but it's just important to note that, you know, there are institutions that are working internationally on this issue with the WHO.
All right, thank you, everyone. So our next question comes from Carla. Just to preface it by saying a lot of our viewers may not know that if they don't pay a ton of attention to Brazil, may not know that last week Bolsonaro fired his health minister. So do you talk a little bit, whichever of you would like to talk about this, about the changes recently happened in the Ministry of Health and how the approach between the previous and the new health minister might affect the situation? Do you know of any other country where the government decided to change their health minister in the middle of a pandemic?
If no one else wants to talk about this, I could, because we just wrote an article about it at Brazil Wire. If nobody else.
Go ahead, Brian. And then I think, Bonnie, you had a point. You're trying to make a point or raised your hand right before. So maybe after Brian answers this question, you can go ahead and ask yours or answer the previous one.
Okay, just very quickly, what we had in Brazil for the first 2 months or month and a half of the pandemic was this situation very similar to Trump and Fauci in the United States, in which Bolsonaro would say ridiculous things about chloroquine or about not needing to use a mask or about not needing to respect quarantine orders. And then the health minister would come on and say, well, that's not what he really meant. What we really recommend is this and that. And because of this, his health minister's popularity, and this is a guy who was historically right-wing. He argued in favor of privatization of the health system just 2 years ago, full privatization. His popularity rating as a voice of reason within the lunatic Bolsonaro administration jumped to 76%, whereas Bolsonaro was just polling at 33%, 36% support for his handling of the coronavirus crisis. And so it looked like there was just going to be this dynamic the entire time, like Trump has with Fauci. But a week ago, Bolsonaro fired him and replaced him with a man named Nielsen, who has no public health experience whatsoever. He's a private oncologist. And since he's taken over, they've already bungled the nightly numbers. 2 nights ago, they said 337 deaths, and then, oh no, we made a mistake with the order of the numbers in São Paulo. It's really 137 deaths. We added a 2 by accident, and he's refusing to hold press conferences. Like, he immediately flew back to Rio, and he's just releasing like a 3-minute home video every night to the nation instead of these press conferences. So that's the situation we have right now. And to answer the question by the viewer, I think that's the only case I know of where someone has fired their health minister in the middle of a pandemic like this.
Thank you, Brian. Bonnie?
Yes, hello. As Brian just mentioned, so much was done in Brazil in the early phases of the HIV crisis and epidemic, and we have with us 2 renowned scientists and healthcare specialists, Maria Amelia and Karin, and I think a lot of people might be interested, as am I, to better understand lessons that you've learned working on HIV/AIDS and other scientists, epidemiologists, public health professionals with regards to, in particular, the lessons learned on the ground, but also issues related to stigma. I know, Maria Amelia, you've studied stigma in groups with regards to HIV, and I've seen some troubling articles come out in media about stigma with regards to COVID-19. along with all the, access to care issues and other ways that people are discriminated against. So if maybe you could address something related to that, that would be very interesting.
And if I could jump in and add another interesting question from one of our viewers, a question that is related to some of these issues, I would like to add that as well. And that's a question submitted by Maria Carolina Sampaio, and it reads the following way. The majority of the Brazilian population is Black. On the other hand, some research indicates that the virus is more aggressive in Black people. Are there studies taking place in Brazil to analyze this relationship? Also, currently, the data released are not yet stratified, and therefore information on social class, race, etc. are not available to the public. Why is that? Difficulty in collecting these data, or politically not interesting to disclose? There we have a different question related to indigenous population. So I think we're seeing some interest from the part of the attendees on, some data specific or more specific data on race, class, and possibly even gender as related to COVID-19.
So thank you both. I will try to make brief comments on those. Starting for the last one, we are just beginning to analyze in São Paulo and beginning to see in São Paulo differential rates of risks of dying for COVID according to race, ethnicity. So a colleague of mine is just this afternoon, we've been discussing this news. For the preliminary data in São Paulo, we see that people from race, ethnicity, Black, have 65% higher risk of dying on COVID-19 right now in São Paulo. So this is classifying the deaths by race, ethnicity, race, color that we collect here in Brazil. So this is really preliminary, but I think it's illustrative that something that we fear, that is, as the disease spread from the population, the affluent population that were traveling abroad and brought probably the virus to the country, and it starts to spread to the less resourceful population, the poor and the people in peripheral areas living in not standard residence and housing, the situation will be worse. And of course, the highest risk and the highest worries we have here is really to protect those who are in those areas, in those situations. We also see some degrees of risks when we classify the percentage of population with certain level of income in the districts of São Paulo. It's already clear that the risk of death also goes into the direction that the poorest have more deaths. The rates of deaths are bigger. Of course, we are taking ecological data here, and we are correlating the real death certificates with other information coming from census tracts and from other sources. I believe that the huge inequality that prevails in Brazil will be reflected also in the risk of having the risk of death for COVID, sorry. My English is totally in trouble today. I've been thinking in Portuguese all the time. So this is regarding to race, ethnicity, and poverty. This is a huge problem. Yesterday we had already death among people homeless coming to the healthcare system in São Paulo city. The lessons that we've learned with HIV/AIDS epidemic could be very helpful to be put in place in Brazil right now. basically, the literature and everyone that has experience says that the response in Brazil was built in a tripod between involving the community organizations, the population, involving healthcare system, the public healthcare system, and the academia and researchers. So this is an alliance that allowed Brazil, in spite of limits of resources, to give a good response to that HIV/AIDS epidemic. That with the up and downs, it's maintained up to today nowadays. And we don't see the same thing happening in the COVID. Although we've seen spontaneously a lot of community initiatives, this is one of the good things. Neighborhoods being organized themselves, poor populations, a lot of efforts to collect donations and money and food for homeless, for those who are living in shelters, for poor communities. So it's a lot of grassroots initiatives that are really give us hope about the country and the people. But we don't see that alliance forged. So when we need what we just described about the Ministry of Health, that is the pillar of the healthcare system, and you have the Ministry of Health in one side and states and municipalities in the other side, in a situation that we need to unify all the resources. So this is also a difficult situation to mobilize communities because of the social isolation. I would say that if we could take lessons from the past, we are not doing the right thing right now, especially from the federal government.
Just to add one more question that is related to the one that was just asked as the other two panelists jump in. The previous question was about the effects that this is having specifically on Brazilians of African descent. We also have a question from Eugenie asking about the effects that this has had on indigenous people and what measures are being taken to protect them as they are already at danger and have been contacted by infected missionaries and evangelists. So just to throw that in as well as a question that could also be answered since it's a related topic.
I was going just to follow what Maria Amelia was saying about, the racial inequities. We've seen the same thing in the United States. In fact, on Friday, we are going to have a pediatric grand rounds where someone's going to talk about disparities and the COVID pandemic, especially when it comes to race and ethnicity. But there's no biological plausibility to indicate that people of African origin would be more prone to dying of COVID. It seems that it's pretty much related to access to healthcare, quality of healthcare, and that is a marker of socioeconomic status and not really a genetic marker, so to speak. So I have not seen any evidence. Of course, you could have more comorbidities in populations that don't have access to healthcare as well. Undiagnosed diabetes, morbid obesity, all these other conditions that will lead people to have worse outcomes if they do contract this illness. So these things are intertwined. We saw the same thing with HIV as well, and access to healthcare is a major problem. As to the indigenous communities, I read just recently a very interesting article about indigenous people in the Yanomami tribes in Brazil, in certain areas of Brazil that are actually, you need a permit to go in. You can't just walk into their villages or anything, some secluded areas, but there's also been a lot of exchange between miners in the region, people who are doing clandestine actually mining and actually coming across these Indian tribes and actually infecting them as well. I don't, what happens with these infections, if you live in a remote area, if you've never been exposed to a specific virus, and this happened in the discovery of America, and a lot of populations were decimated by measles or other infections that might not kill the Europeans at the time. It's the same thing when you have a primary infection in an adult who's never been exposed to a virus. You usually have more, overwhelming bad outcomes. It's sort of the natural history of many illnesses, and that's what we're seeing with COVID worldwide. We don't see many children having terrible infections, but we definitely see it in older populations. So I think that in these indigenous communities, if you are exposing small groups of people, you know, and they've never had respiratory viruses to begin with because they've been so isolated, or that class of respiratory viruses, and have no pre-existing antibodies, you're going to have a worse outcome. Having said that, in some studies of Native Americans with some bacteria, some pathogens, there could be a genetic susceptibility in some situations. I'm not saying that this is true for COVID at all, but there have been studies demonstrating that certain populations are more prone to having, for instance, pneumococcal disease or other infections not do so well. So that's, but what they're doing to protect the indigenous people of Brazil, I'm not so sure. Maybe Brian knows the answer. I think very, very little at this point.
Amelia, you raised your hand.
Yes, thank you, Jose. I just like to complete that the indigenous population was facing a lot of threats to their reserves, to their lives, to the way of living already. So this is something previous to COVID. More indigenous reserves and land invaded, and more mining exploding, illegal mining exploding on indigenous territories in the past months, in the past year. The one thing that we know that is the Xingu people, it's a large reserve in central Brazil. They decided to quarantine themselves, and they are doing all the efforts to protect their own people. And we also know there are already deaths among indigenous population in the Amazon, indigenous person on the Amazon by COVID. So this is a very tense situation and a very vulnerable population to COVID as well for several reasons. Just one quick comment on the stigma and discrimination of population affected by HIV that could be also at risk of COVID. Usually you have huge infectious disease hospitals and facilities who are primary care centers for HIV population. And now some of them are totally devoted to COVID. HIV patients who are living with HIV under treatment, the ones who were stable in their treatment took medicines for longer periods to stay without seeing a doctor. But we know, for instance, that the ones who are not adherent to treatments, the ones like the transgender people with difficulties to face, already face a lot of difficulties to have healthcare because of stigma, discrimination, etc. Probably will have worse outcomes in their HIV infections once the COVID isolation and quarantine pass. So I think that the consequences over those groups who are vulnerable already for other conditions will tend to be worse when we have more information about in future. Thank you.
Ryan and Bonnie, any thoughts?
If I could just say that there's already a genocide attempt against indigenous peoples launched by Bolsonaro and his ruralist backers underway before coronavirus hit. And I'm not being melodramatic or exaggerating. There's actually a case for genocide against him in the International Criminal Court in The Hague for encouraging killing of indigenous peoples. The Yanomami reservation has thousands of illegal gold miners in it right now. They're supposed to be an isolated tribe. A lot of them are already dying of diarrhea before the coronavirus crisis started because the rivers are all being polluted with mercury and all of these mining trailings. Okay, so the situation is really critical. Coronavirus is just one of several things that are going on right now that are putting the entire population of indigenous peoples, and we're talking about hundreds of different cultures and hundreds of different languages here, in the Amazon region at risk.
Thank you, everyone. Just one thing to mention as well, para quem está assistindo no Brasil, eu sei que tem gente que talvez entenda inglês, mas não se sinta confortável escrevendo uma pergunta em inglês, então a gente aceita perguntas em português também, para quem quiser. I just want to make sure everybody knew they could also submit questions in Portuguese if they like. I have a question from Jennifer for all of our panelists. This pandemic has taken a toll on education globally. How has the pandemic affected Brazil's schools and education system? What is the country or states and cities doing to supplement classes, especially for primary education? And I would just add to that, in a country where a lot of kids aren't going to have reliable internet access at home, for example.
Well, starting a little bit about the situation here in Brazil, I would say that maybe 100% of schools, universities, colleges, etc. are closed at this moment. And there is a huge variation in it, which measures they are taking to provide any kind of education while the kids are at home. We know there are schools well prepared and transfer to everything to distance learning, education through web and different resources, and others that don't have that much. Some schools also anticipated the holidays. So what's going on here is that some are officially on the holidays that should happen in June, July, late June, July, are now on holidays, waiting to see. So the school calendar will be completely different when we come back from social isolation. But I think there is a huge problem with the parents at home, people that are doing home office, especially women, that have to take care of the education of kids, small kids, have to take care of the house, have to work from home. So there is a lot of tension, domestic violence. So this 2 days ago, the police released that the announcements of domestic violence in São Paulo state increased 20% in 1 month. So there is a lot of things going on, but especially the education system is being using different resources to try to implement some activities while the kids and the young people are out of the schools.
I was just going to add that from a personal perspective, I've seen that my family in Brazil, kids who are in private school in Rio are having, tele-learning, the classes are online and so forth. Private universities are giving online courses, but universities like the Federal University has shut down, and I believe most of the public schools in Rio do not have the infrastructure to provide any video learning experience to the students. So as Maria Amelia said, they're shut down. So you see this inequity as well in regards to education. If you're in a private school, your English courses, your private English courses, everything's shifted to online learning. But if you're in a public school, you're just going to miss that time and not get any education for the most part.
Right, thank you. Another question. It's not from one of our attendees, but I think it is a question people will be interested in hearing an answer to, and it's specifically for Maria Amelia and for Brian, who are in Brazil right now. What are things looking like in your neighborhood, for example? We've talked a lot about official government policy. We haven't talked as much about how ordinary people from a variety of social classes are reacting to the disconnect between what Bolsonaro says on the one hand and what his former health minister said on the other. So whatever the government is doing, what kind of response has there been to social distancing and to the shutdown of the country from ordinary Brazilians?
I guess I could go. I'll go first here, and then Maria Amelia could maybe go after, if that's okay with you. Okay. Sure. I live in a working class neighborhood on the periphery of São Paulo. I live in Jaraguá. I'm a longtime housing activist, and I live in a social movement housing condominium, and on the edge of a favela here. What I've noticed is that, first of all, in terms of the commute, I go out to the supermarket at 7 in the morning when it's still empty, and I see that the number of people waiting for the bus is about 1/4 of the normal size of commuters I would see at that time in the morning, but nobody's using a mask. The only people I see walking around on the street with masks on are elderly, and I'm the only person I've ever seen walking around in my neighborhood with gloves and a mask on, and I almost feel guilty, you know, like it's almost like a new class system or something. Now, in my neighborhood, one of the neighborhood bars is closed, the other one stayed open. You know, it's on the, since it's in the entrance of a favela, it's not being audited really. You know, like if we were downtown, the police would come by and say to shut it down, but it's not happening out here. And I see people on the street, I hear the neighbors are evangelical Christians, and when Bolsonaro gave a big address about how you didn't have to pay any attention to quarantine, they started letting their kids play outside again. And so I feel like the statistics for the state of Sao Paulo say about half of the state is obeying this quarantine, which is better. The US, I guess, is 44% nationally. So I guess it's pretty similar to the US maybe, in that we have these kind of, the equivalent, Brazilian equivalent of Trump fans are just acting like it's all conspiracy theory and walking around on the streets. And then a lot of people are staying at home.
So one different perspective. I live in a middle-class neighborhood called Pinheiros, close to Vila Madalena, very popular and neighborhood for nightlife and etc. And there is, I would say, the social isolation here is working a lot. You see very few people in the streets. Some people go out for walking and jogging, etc. But most of the people are locked in their own houses all the time. Increased the number of deliveries by motorbikes because everybody's buying things by internet and food. Everything comes through delivery right now. The restaurants are all closed. The supermarkets are open, but some of them have put on the line some measures so people can keep distance. They have some glasses protecting the cashier from the customers. I go to organic market, for instance, and they organize, some of the days they close, then they decided to prepare some baskets that you buy through internet and you go just pick it up, but now they are offering the opportunity to people go in small numbers. So it's really different from neighborhood to neighborhood. We know that. We know that in certain areas of Sao Paulo, the city is really obeying the social distance and doing and organizing themselves to do that. And my building, we are 11-floor building. We are not allowing the employees to come, just one from security. So the cleaning and everyone else is not coming. And we are doing rotation to wash our stairs and clean the common areas of the whole building. So it is really taken seriously here in this neighborhood, but we know that it's different in parts of the city. And interesting, every day at 8:30 p.m., we go out in our windows to beat our panelaços against Bolsonaro. And this is not a neighborhood that was totally against Bolsonaro in the election. It was interesting because before the election, we could feel supporters of Bolsonaro and supporters of the candidate of PT, Fernando Haddad. The Haddads were minority, vast minority. It was possible to identify in which building or apartment do you have supporters. Now I cannot see anymore because apparently everybody's against the president in the neighborhood. So that's how is the personal perspective here. I'm at home, working from home, 30 something days. And left the house 3 times. One to go on TV in one live program, talk about COVID, and the other one to buy groceries and stuff like that. Most of the time.
So I want to go ahead and pass along a question from Marcelo, who has asked us. He says, "I still don't understand why people from the government and other private and other places supporting Bolsonaro's responses to coronavirus. Basically, what we hear about is that Bolsonaro is sort of doing this by himself, right? That Bolsonaro is kind of going against the flow." Marcelo is saying, surely there are other people. Surely Bolsonaro has support from other sectors of society or the business class or of other places. So I was wondering if you guys could talk a little bit about the ways about Bolsonaro's sources for the support that he does have right now.
Well, if you don't mind me starting off here, it's obvious that just as Trump has a lot of support from elites, from business elites, for pushing to end quarantine, Bolsonaro has the same kind of support. I mean, even Thomas Friedman in the New York Times op-ed section wrote an editorial supporting ending quarantine. So it's not that outrageous of a suggestion from a business standpoint. Big business has always supported letting people die in order to advance business interests. Look at how cell phones are made out of Cotran from being mined by children in the Congo right now, okay? So, for example, Banco do Brasil is the richest bank in the Americas. The president of Banco do Brasil supports Bolsonaro's calling for an end to quarantine. So I think in the case of Bolsonaro, he has a lot of rich business backers, in addition to this kind of 15% of the population that's been analyzed, that's like far-right, ideological, the kinds of people who would like Steve Bannon if they were in the United States, who support Bolsonaro because they think he's going to kill all of the communists and this kind of stuff. And they believe all the 5G right-wing conspiracy theories. But he also has business support, you know, and we know he's also heavily supported by the US government. And he's the first Brazilian president ever to visit CIA headquarters in Langley, Virginia, which he did with his justice minister last year after becoming elected. So we feel like he's kind of like, there are powerful interests behind him. And that explains why someone who's so unpopular with the majority of the population can be in power still.
Anybody else want to add anything to that, or should we move on to our next question? I mean, the time we do have set up to end is at 3:30, but we do have more questions, and we have no, I mean, I'm not going to try to keep our panelists here all night, but provided our panelists don't mind a couple more questions, we could go ahead and answer a couple more. Is that okay with everybody?
Well, we should also save a couple of minutes towards the end for a final round of perceptions, and maybe we could try and outline for our viewers a sense of the next step, what's to come, what the stakes are for Brazil, and what actions should be taken, or what actions are needed. So this would wrap up our panel nicely. So Brian, I understand you have you have selected the 2 more questions. Is that it?
Yes.
Or, please, the panelists are also allowed to ask questions to each other, to one another. So as you know, as you please. So Brian, go.
I think we have what's really important question from Alice, who is asking to all of our panelists, how do you evaluate COVID media coverage in Brazil? Is Brazilian mainstream media acting as an ally to Bolsonaro or an ally with public health experts? What's the Brazilian media's take on this?
As a member of the Brazilian media, I guess I'll just to be very quick with this. It looks like the Brazilian media, the big media oligarchies, you know, traditionally are kind of like center-right, neoliberal in their political orientation. They've all broken from Bolsonaro over coronavirus. They're all supporting quarantine efforts and things like that. And I know, Brian, they even Estadão de São Paulo, which is one of the most conservative big papers in Brazil, got in touch with you the other day and ask you for some comments about this all. And that's a sign of how much they've broken from Bolsonaro. But we know that his backers are spending 1 million reais a day on viral WhatsApp campaigns spreading conspiracy theories, saying that the virus was invented by the Chinese to kill Westerners, to destroy the Christian way of life. I see the ads coming down my Facebook feed. So it's like that Bolsonaro and his people have abandoned the media, and they're basing their power coalition on social media.
Anybody else want to add anything else to that? Okay, then we have 2 more questions, which are really one question. So I'll ask both of them. It's from Josemina and Katya. Where do you guys think this pandemic will take Brazil? And if you think it's taking Brazil to a bad place, what steps can be taken to change that? And then also more broadly, can you comment on the impact of the pandemic and Bolsonaro's leadership, as well as that of the governors, on the future prospects for Brazil's democracy? So where do we go from here?
Isn't that almost like a final question you could ask all the panelists?
I think it is. It is addressed to everyone. It's sort of the way to enable you to segue into your closing comments.
So I can start. It's very difficult to predict where this is going on, where this is taking us. So I would not say going in this direction or that direction. What I think that can be a good outcome of all this tragedy and all the difficulties is a major recognition of science. I think that is the public health system that is the backbone of the response right now. And I think if we can show the population, for instance, there was in the Brazilian middle class this aspiration to have a healthcare insurance or something. Even under previous governments, there was something being sold to the whole population that is, well, to prosper in your life, you should have, or this is a mark that you are going well if you have a private insurance. And we see the role that the private insurance are doing in this COVID epidemic is really bad. So they are taking advantage of that to have even more funding, resources, being able to access some specific funding and regulation that they were not able to do before. And the response they are doing is really a pity. So we have lack of commitment, we have, I would say, lack of collaboration. And at the end, my hope is that the healthcare system, unified healthcare system, public, that is underfunded, but is the only source, the only resource for the majority of this population, will be better evaluated, because you don't have how to build a response to a problem like this that based on private interests and small insurance companies anyway. And the other outcome that I expect is that the population believes or take more attention to the science, the production of evidence, and less to fake news. I think that it's true that what Brian said, I don't see in the big media any support to the insane calls of our president. And I think that align all these big voices, conservatives in one hand to others, at least to say something that you need to value what is scientific producing on this. So I think that could be a good outcome for Brazil, but I have no idea where we are going right now.
Well, I guess I would step in and say that I echo what everything Maria Amelia has said. I do believe that this is a catastrophe. And having worked in Brazil ever since I've come to the US, I think that this is overstretching the limits and what the Brazilian health systems can deliver. On the other hand, I think it will bring a lot of awareness to how important a public health system is, both in Brazil and in the United States. It's also, you know, people have to have $600, $700 insurance plans a month to be able to go to a hospital here to be taken care of. And this is enlightening, I think, the world to the fact that we need to have a public social form of medicine that is effective and works in both places. And everyone is becoming increasingly aware that this is imperative. Otherwise, we cannot test, we cannot treat, we cannot diagnose and manage anyone. So I think a good lesson from this epidemic catastrophe is that. And the other thing is, again, the value of science. We have dealt with a lot of anti-vaccine movements in my field, especially, which is pediatrics and infectious diseases. And I think that we are now begging and claiming for the development of a vaccine against, I think we all would agree that we all want a vaccine that works and, you know, prevents this tragedy we are seeing. So I think there will be potentially a renowned interest in development of vaccines and realizing that they are necessary to protect the world. So I think this might be a good outcome. I hope that this also will help us get rid of inefficient leaders, because their ineptness and incompetence is becoming obvious before the eyes of the world, and increasingly so as this epidemic unravels. So this might be helpful when election time comes for people to evaluate, you know, what happened here and what was the response. And I think it will be a lesson learned. But I'm generally an optimistic person, but in terms of this COVID pandemic, I'm very pessimistic. I think it will be horrible to the economy. It will be horrible to the Brazilian vulnerable populations. It will be terrible for Brazil. Unfortunately, I wish I could say something else, but that's my opinion.
Okay.
Yeah, go ahead. If you have any further
yeah, sure.
comments.
What I see happening, you know, politically, first of all, when this broke, some Brazilian authorities and scientists were predicting that by now the hospital system in Sao Paulo would be collapsed. The hospital system in a lot of states would be collapsed. And what we're sitting on right now is 3 states out of 26, plus the federal district, have their ICU units full. Sao Paulo, from what I understand, is about 80%. Maranhão, which is Sao Paulo, the richest state in the country, Maranhão, the poorest state in the country, is about 70%. And I feel like what Trump's doing, and by proxy Bolsonaro, who's his copy, who's trying to copy all of his tactics, is continually saying we should end the quarantine because of the economy, end the quarantine because of the economy. He's betting that the death toll won't be as high as what people predicted it would be, so that when this blows over eventually, he can say, look, everyone made a big stink about nothing. Now the economy's crashed and burned. It's their fault. It's the liberals' fault. And this could be manipulated by him into maintaining power. You know, right now we have 2,700 deaths in Brazil. The Center for Operational Health Intelligence, which is made up of field crews and some of the top university research departments, estimates the real infection number based on hospital records, which are updated daily, is 12 to 15 times higher than official numbers in terms of infection, and about double in terms of the death rate. I hate to say this, you know, because I really hope that the death rate doesn't build to the point that people were predicting a month and a half ago in Brazil. But if it doesn't, I feel like Bolsonaro is already laying the groundwork where he can blame the economic crash that's happening right now on the left and consolidate his power.
I would just add that I think that you have to look at the overall deaths, because Brazil has vastly undertested the population, so we can't say who's infected or who's not. So we would have to look at the exceeding number of deaths during
Yeah,
this.
but just to add, that's exactly what they're doing. That's what, I mean, there's several academic and scientific research institutes that are monitoring the death rates for pneumonia and respiratory elements, which are updated daily in the health system, you know, in the public hospital system. They're monitoring, that's where they come up with the numbers. Hospital records are things besides coronavirus.
So may I say something?
Of course.
One of the good things that is happening is that there are several groups working together, trying to model the situation in Brazil, exactly as Brian is reporting right now. We are doing this in São Paulo. It's taking the past year's estimates of deaths for all respiratory infections, for the severe respiratory acute infection that was a system in place when we had SARS, and we still have that system. This is the system that is being used since March to report possible suspects of COVID. So we've been comparing those and doing different scenarios, estimate that a certain percentage of those deaths are due to COVID based on the data we know, and extrapolating that to estimate the real numbers. So there is a lot of going on here. In this sense, we are studying and we are providing information updated every day to policymakers, to researchers, to the media. So this is a very positive environment and outcome. Just to give you an idea, this group I am working with, we didn't know each other. So we are all in São Paulo, in different institutions. We are in Santa Casa, in USP, Unesp, Federal, ABC, and we were put together in an observatory of COVID, and everybody's working online and cooperating, bringing different expertises to try to come up with an idea where is the epidemiological situation, and to estimate some of the trends that we will see in the next days, calculating number of ICU beds, hospital beds, number of tests. So this is an intense work going on every day here. So we are trying to fulfill the lack of information that the system have, the lack of diagnostics by the insufficient tests, but we have good modeling and projections of what is going on.
And DataSUS is the biggest health database in the whole world, so that should be helpful too. I just want to say that what happened in New York when they counted the number of people who were dying at home, dying in the streets, or dying without a diagnosis, that it inflated the COVID, and they attributed those cases to COVID. In retrospect, that increased the death toll by 3,000 only in 1 week. Governor Cuomo did that. So it's something that we also have to look, because many of the people who die might never be hospitalized in the first place. So that's also, we have to look at death records as well.
We can say that there's spuriousness in the US, and that a large percent of the US population is afraid to go to the hospital because they don't want to go bankrupt as well, though. You know, like people in Brazil aren't afraid of going to the hospital for financial reasons, at least. I'm not saying that the death rate isn't much higher than the official numbers, but there's characteristics unique to the US system, which luckily for us in Brazil, we don't have. Like, nobody's afraid that they're going to go bankrupt if they go in thinking they have COVID and they're diagnosed with something else. Now that Mike Pence has said they're covering the COVID diagnosis and the COVID treatment, you could still go in with no insurance in the US and think you're going to be treated for it, and you find out you don't have COVID, you have regular pneumonia, and then you've got like a $20,000 hospital bill. It's crazy up there. Sorry, I'm rambling.
But people don't come because they're afraid of getting COVID in the hospital. I work in the hospital, and all the clinics and the public hospitals in LA as well. The census is all down. People are afraid of being exposed, so they avoid coming to the medical setting, first and foremost for fear of being exposed to COVID. So at least at UCLA, that's the prevailing reason that the numbers are low.
So
Bonnie, any final thoughts? Amelia, did I?
No, we've been studying that's occurring at homes as well. And São Paulo City has a very good system for reporting deaths. This is traditional. It's been in place for more than 30 years. It's basically 100% of the deaths are reported. It's all public system. There is no private interest in cemeteries or anything. It's all controlled by the municipality of São Paulo since the late 80s. Luisa Erundina, the mayor, did this in 1989, and it's kept in place. So there is a team studying all the time the deaths every day. So we have a very short period in which the day of death and the information come to the system and being studied by a group of experts that the municipality has, and some of our work are helping them to qualify those data.
Thank you, Amelia. Well, I have no words to thank all of you for participating in this panel, which has been extremely interesting, helpful, thorough. Again, I would like to thank and welcome Brian Pitts. It's so nice to have you on board, Brian. You have no idea. And we owe you this successful first event in this, I guess, resuming of our programming for the Center for Resilient Studies. If you are watching this live via Zoom or via Facebook Live, please check our calendar of events. I understand that there will be other COVID-19 related panels and sponsored by the Latin American Institute and the International Institute in general. Bonnie and Brian, do you have any events or announcements to make related to our programming, the upcoming events or panels planned?
Well, in collaboration with our Center for Mexican Studies here in the Latin American Institute, we are planning a very similar roundtable on Mexico's response to the COVID-19 pandemic. We're still finalizing our list of participants, but that'll probably be the first or second week of May. And then in addition, the International Institute here is organizing a series of events that will bring in presenters to give a more global perspective. So, maybe an event on the global rights response with discussion of, the Philippines and Hungary and Brazil or something like that. Right. So there's some of the events that we are working on right now.
Right, so keep an eye on our calendar. I understand that we are recording this and following the due procedures and the release forms, etc. This might become available for viewers who didn't have a chance to follow it live. If that's the case, this will be announced, and information to access the panel will be available to you in the Latin American Institute website. In my own home department, we're also resuming our activities and plan for next week on Wednesday at the same time as this one. We're going to have a short panel with writers from Brazil and Portugal addressing what things, what people are doing and writing and reading during their quarantine or isolation, and how literature and culture in general is responding to the COVID-19 crisis. This event will also be shared in our calendar of events. Thank you again so much, Brian, Amelia, Bonnie, and Karin. It's been a pleasure to listen to you. I've learned a lot, and I invite you to also participate as a viewer of our next events. I hope you're all safe and in good health at home, and thank you for watching our first broadcast of the post-COVID-19 crisis for the Center for Resilient Studies. And Brian, who interrupts the broadcasting?
That's me.
Okay, so you have the power.
I'm going to click end meeting and everyone's kicked off.
Thanks, everybody.
Thank you.
Thank you.
Thank you so much,
very much. I appreciate it.
Thank you.
Thank you.
Thank you, everybody.
Nice to see all of you.